business person, I've been very committed to providing everybody with good health insurance, but particularly women, and making sure that we're very, because and even our narrow self-interest is not served when our young bakers are having too many babies. It doesn't help anybody when you know, $16 an hour people are building huge families because they don't have any resources. So, and then I'm also the board chair of this organization called the Chefs Collaborative. And so we're here for the food track. We're here talking about sustainability and the purchasing power of chefs in the food industry. And that's kind of what our bakery is very mission driven, based on kind of, as I like to say, from soil to sandwich, we want a healthy supply chain. So it's based in environmentalism and flavor, but what happens is that you end up, actually once those become your primary values, you end up engineering your own supply chains where you're having to look at kind of like, okay, if we're all going to do the right thing, and right now there's this one sort of pig in the python, like processing or transportation or production is making all the money and everybody else isn't, we have to find equity along those supply chains and then beginning to develop values aligned producers, essentially.
Good. I was just doing a little fact checking.
But so that's been I'm a food systems geek and a bit of and I grew up on a farm and have a lot of agriculture, so like I have this weirdly deep knowledge of like the meat industry. Everybody's like, but you're a baker. I'm like, but we have to buy meat, because we have bakeries, and we have a soup salad sandwich program also. But we do everything from scratch.
Hello, everyone. Good morning.
For our scale.
Yay. No? Good morning. No, that works. Okay. Hello, I'm Betsy Hand. I'm the community chair for the Conference on World Affairs. And I'm so happy to welcome you here this morning. We've had a great first day. How many of you were here yesterday? Woo!
Wow.
Super. Well, I hope your day was great, and today is going to continue to be fabulous. I just want to take a moment to break in here and pitch donations to CWA. There we go. I'll just say it out loud. I want you to know that I'm a financial supporter and of CWA, and I just want you to know that ever since my daughter was in school here forever ago, I've just been a huge fan of CWA, and when we moved here 13 years ago, I came over to the campus every April and just spent the week here. I put my backpack on, put my sneakers on, and came on over and spent. So finally I decided it was time to step up. We have been housers for many, many years, but finally we really stepped up. I joined the arts committee last year, and then this year became the community chair. And I've had a great time working with the students and the university making it happen. So I just want you to know that it doesn't all happen for free, even though it is free. And we would love to have your support. And there should be producers in the back oh, there you are, Millie's here. Yay, thank you. Students are here with envelopes. So if you would like to help CWA thrive, please take an envelope and fill it. And thank you very much. Have a good session.
Good morning, everybody. Oh, I like that. I'm from the South. When you say good morning, like people, let's try it one more time. Good morning. Good morning. I love it. This is session 2152. Now, I know you all know what day this is, but people are going to be watching this in the future, so I'm going to let them know it is April 11th, 2017, and we are doing Thou Shalt Not Mess with Women's Reproductive Rights. Fallopians, chapter 20, verse 17. Now, this came from the Women's March on a sign. Is it not fabulous? So we have a high-tech way of doing questions. Conferences across America are changing the process. And so we're going to be utilizing the CWA app, which if you don't have it, you can bring it down on your iPhone now or your iPad. And also, even more high-tech, a note card system. So that's how we're going to be receiving questions from you. So if you don't have the app, you can raise your hand, and our wonderful producers, Millie and Sydney, will bring you a card, and you can write it down. Write your question down. So to ask a question in the app, simply select this session in the schedule, tap Live Q&A, and then insert your question. You may also raise your hand at any time to request a note card and pencil from one of the producers, then give your question to the producer. If you are a student, please note this in your question. Questioners who would like to verbalize their question can note this in the text, including your name, and if I select your question, I will recognize you and invite you to the microphone. So that's how the process is going to work, and I'll remind you about it later. I'm going to ask for you all to turn off your cell phones or do whatever you need to do so that they don't interrupt your neighbor and the rest of the group. And without further ado, I will let you know about our panelists. So the first one here is Karuna Jagger, and she is the Executive Director of Breast Cancer Action. So Breast Cancer Action is working, they are a watchdog organization that is really looking at how corporations are making big business out of treating breast cancer and really looking out for women's rights in that process. So that's the lens that she's going to be bringing to us today. The next woman is Liz Winstead. She is co-creator and former head writer of The Daily Show. So she has, yes, you changed the landscape of how we talk about news, Liz.
Yes, I did it single-handedly. I'm magical, and get on your knees.
And she's going to be making us laugh today. I mean, really, you've brought together laughter and politics, which is a very hard thing to do. And she spends most of her time at Lady Parts Justice League, a reproductive rights organization that uses humor and outrage to mobilize action. And on their website, it says one of the 5 reasons to join Lady Parts is because you like sex. And it's not all about having babies. Think about it. If there was, there would be no room to stand. The next person is Bill Ryerson. Bill is former and president of Population Media Center. PMC, really interesting organization. They are doing soap operas on radio and TV around the world in developing countries to really educate people on different issues. For example, in Ethiopia, they have found that they are using contraception more regularly as a result of his program. And when you go to the website, it shows you how much the population has increased over the time that you spent in that website. And the amount of time, I think I was there for something like 40 minutes, it was 7,000 people. It was actually a terrifying and a very educational number for me. So, Bill, welcome to our panel. And then on the end is Piper Davis. Piper is here for our food stream of the conference. But she is a powerful feminist and believes strongly about the topic. She's a partner at the Grand Central Bakery, which is a regional chain of 10 artisan bakeries and cafes in the Seattle-Portland area. It was started by her mother and is owned predominantly by women. And as she says, it's like kind of all political issues often land at business's doorstep. So she's going to be bringing that issue or that lens to our perspective. So I've asked each of the panelists to spend about 6 minutes kind of opening up our topic for us. So you want to start, Karuna? We'll just go straight
sure.
down.
So Piper and I are going to bookend this panel with sort of a sideways step on the, a kind of a different angle on reproductive rights. So as Barbara explained, I run Breast Cancer Action, and I'll let Liz talk about, all the ways in which women's ovaries, uteruses, kind of what folks think of as reproductive rights are legislated. And what few people realize is the ways in which breasts are also legislated, and the ways in which, once again, our legislators think they know more than medical researchers and are failing to follow the evidence. So to do that, I'm going to have to start this by talking a little bit about the evidence, which, remarkably few people understand and know. So really, the pink ribbon culture the mainstream pink ribbon culture has promoted a simple solution to a complex problem. And we're all told that mammograms save lives. And unfortunately, the evidence is very clear that when you examine women who have had routine mammograms, so asymptomatic, average risk women, compared with women who have not undergone routine screening, in fact, overall death rates are the same. And the number of women who die from breast cancer may be one in, basically, if one woman in the screened group does not die of breast cancer, she'll die of something else in the non-screened group. So overall mortality rates are the same. Do you see what I'm saying? Meanwhile, tens of thousands of women are overdiagnosed and overtreated. And I know this is just absolutely counterintuitive because we're all told, but screening saves lives. And it does for some cancers. But with breast cancer, the lead time that screening buys you does not change the outcome of the disease. And so if you wait until that lump is palpable, the outcome is the same. Again, breast cancer is a single term that describes a lot of diseases with different characteristics. And so there are some cancers, breast cancers, that are so aggressive, it doesn't matter when they're found. We just don't have treatments that work. And then there are many lesions and small cancers that are indolent, that are small growing, that will stay in the breast and will never become life-threatening over the course of a woman's life. And this is, I think, all of this should be common knowledge. Any test, any procedure comes with harm and benefit. And unfortunately, when it comes to breast cancer, we've promoted this, simple solution that is frankly not working over the evidence. And we're not giving women full information about harm and benefit so they can make choices that are right for them. So in any event, once we know this, and we know that the United States Preventive Service Task Force, which is an independent panel of primary health providers, preventative health experts, they review peer-reviewed science, and they also concluded that the benefit of mammograms is modest. And if women do benefit, it's most likely to be middle-aged women between 50 and 74, and at most, a mammogram every 2 years is sufficient. Even all of these recommendations are intended to be used by physicians and by women to make informed choices. But what happened, and this is where we get to the legislation part, what happened is that with the Affordable Care Act, legislators said, so the USPSTF makes recommendations on all kinds of things. And for vaccines, for other kinds of cancer screenings, genetic testing, lots of things. And the lawmakers said for the Affordable Care Act, in order to set some minimum coverage standards, they would use the United States Preventive Service Task Force guidelines on particular issues. And this would set kind of the minimum coverage standards so that people, for preventive care services, so that people wouldn't have to pay, co-pays. Well, they exempted mammograms. So the USPSTF does a good job on everything except mammograms. So I think that's the first, and I'm trying to keep it to 6 minutes, but I think that's the first place to really examine why is it that we've politicized breast cancer in a way we haven't politicized prostate cancer, for example. Another area where breasts get legislated and where legislators don't follow the evidence is around dense breast notification laws. How many of you have heard of those? Yeah, well, Colorado, your governor just signed a bill last week, I believe, making you the 29th state to require health providers to notify women about their breast density. Here's the thing. Breast density is a normal, it's a normal physical phenomenon. It just describes the percentages of tissue in the breast, and so dense breasts just have less fat, more kind of glandular and connective tissues. About half of all women may have dense breasts. It's more common among younger women. And the reason it matters is because it makes it harder to read a mammogram. Mammograms are less effective for women with dense breasts. Well, here's the other thing. There's no evidence that supplemental screening makes any difference. And there's no recommendation that accompanies the breast density, there's no evidence-based recommendation no action that women can take. I'm sorry, I'm getting the signs, so I'm trying to wrap it up. We'll give you the information to make this make sense. So here we have a situation where 29 states, more than half of all states, think it's okay to require that health providers say specific words to women about breast density. And that means that conversations between patients and providers have been legislated and cannot follow the evidence. They can't be responsive to evidence as it emerges, right? Because we know that laws don't keep up with evidence. And so, you know what I'm saying? Like, lawmakers have to go through this much longer process. And really what needs to be happening is that providers and patients need to be having conversations about a range of issues. And it should not be, it is not the purview of legislators. So there's another way in which I believe that politicians are basically political pinkwashing. They're trying to score political points by saying they care about women's health, and they're not taking actions that are actually would really make a difference in women's health.
Thank you, Karina.
All right, Liz.
So I'm going to talk about mostly abortion. Because I feel like we don't talk about abortion enough. We have taken abortion and taken it out of the menu of health decisions a woman might have to make in her lifetime, a person might have to make in their lifetime. 1 in 3 women will have an abortion in her reproductive life. And the abortion legislation has been based solely on fake science. 100%. It's been based on literally legislation about Plan B and IUDs, calling them abortifacients, when an IUD and Plan B actually stop a pregnancy from happening in the first place. So we have laws on the books that ban abortions for people who aren't pregnant. In Colorado, you had an incredible run by a funder who funded an IUD program here that reduced
The best story ever.
that reduced the rate of pregnancy in teens and low-income women by 40% by making access to IUDs. When the program is a wild success, and they turned to the Colorado state legislature and said, hey, how about you guys fund this now? Because it's like literally the best money a state could buy. They were like, nah, we're not gonna fund it. So statistically, as we live right now in America, 87% of all counties are without an abortion provider. 78% of all counties in Colorado are without an abortion provider. We cannot use federal dollars for low-income women to receive abortion care. And these laws profoundly affect low-income women and women of color. And I just have to say, being on a panel that's all white people talking about this issue is kind of a bummer for me. Because women of color who need to talk about reproductive justice should be up here talking about their experience, because you're gonna get a worldview that's gonna be awesome and amazing, but it's not gonna be from the people who are affected by this issue the most. And so I just needed to say that because it feels slightly uncomfortable for me to be on a panel with people who are not directly affected in America by this the most. Having said that, there's tons of stuff we can do that we'll get into. I'm gonna cut my time short because we have a big conversation to have. But I'm really thrilled to be here to talk about this because it really matters, because the more we talk about abortion, the less shame and stigma we have, and the more that we can put providers up and celebrate them in our communities, because they do really good work and they really clear a path for people who would no longer, or maybe not, have a destiny that was their own. And the bottom line is, if we're not allowed in a civil society to create our reproductive decisions, we're not free.
Thank you, Liz. All right, Bill.
Thank you very much. I think based on the 2 previous speakers, we should lobby for legislation requiring the public to be informed of the density of their policymakers.
Oh my God, you win.
And you got that from Liz.
I'm sitting next to her, but no, I didn't get it from her. For the young
No, I mean,
peop-
you got the laugh from Liz, which
Oh.
is a really good thing.
Yes. Oh, thank you. For the young people in the room, I have an announcement which may surprise you. All of us are here because our parents had sex. And yet, many churches basically give the message that sex is dirty, so save it for someone you love. And basically what young people take away from that is it's okay to be swept off your feet, but planning for sex is somehow evil. So indeed, we need to move our society with this basic, fundamental human behavior to be able to plan for sex without shame, because indeed, everybody is sexual. And one of the key elements of planning for sex is how to not have consequences. Sex should be consensual, it should be pleasurable, and it should not have consequences we do not want. And there are multiple consequences, as you all know, that can occur from sex that is not protected and not planned for. So indeed, I've spent my career mostly in reproductive health and family planning. I've worked with 2 Planned Parenthood affiliates. Now we're doing family planning soap operas so far in 54 countries, primetime serials. But just to summarize progress of the last 70 years, in 1960, 10% of the world's couples use modern methods of family planning. Today, 56% do worldwide. So that's a huge change, one of the big public health success stories. However, because of growth in the number of people on the planet, the 44% non-users today outnumber the 90% non-users from 1960. So there's still a huge need for services and information. The reasons for non-use of contraception in 1960 were people didn't know it existed, they didn't have access to it. Today, lack of access is cited as a reason for non-use by less than 1% in most countries. The top reasons are they've heard it's dangerous, and indeed people are giving out intentionally misinformation about safety and effectiveness. So in Kenya, you can go to church and learn that condoms contain the HIV virus and the lubricant, and you're better off not using condoms. And people are dying of AIDS because of this criminal misinformation. So fear of health effects, male opposition, religious opposition, personal opposition, and fatalism. That is the belief that God determines how many children you're going to have, and there's nothing you can do about it. Those are the dominant reasons for non-use of contraception, other than the one I forgot to mention, wanting more children, which makes sense. So that's the number 1 reason for non-use. So overcoming those cultural and informational barriers requires communication, and that's what our organization does, using entertainment media. Since people don't go home at night to listen to health messages, we have suspenseful 200-episode storylines in which key characters are getting caught in the crossfire between positive and negative characters as defined by the policies of the host country. And those key characters are sorting it out as we gain an audience and evolving into role models for stopping child marriage, use of family planning, daughter education, stopping violence against women, environmental protection, and child nutrition. And we can indeed measure changes in social norms when we're attracting 50% of the population of the country. In this country, if you haven't seen it, I encourage you to tune in to Hulu and watch our show, which is in the top 5 on Hulu, called East Los High. It's filmed in East Los Angeles. It's about the lives of Hispanic teens. It's in English with a little Spanglish thrown in, but it deals with teen pregnancy. Season 1 shows abortion as a successful outcome to an unwanted pregnancy. And I made that decision that would be the primary content of the storyline of season 1. So, but we also deal with domestic violence, obesity, gay relationships, and a whole array of other issues affecting the Hispanic community. And the show, for the first 4 seasons so far, has been the #1 show on Hulu Latino. Now, one comment about messing with reproductive rights, and you've probably been wondering when we would get to this on this panel. You may have heard of Donald Trump. And he has made the decision in his wisdom that indeed we should remove 100% of the funding from the UN Population Fund, the major supplier of contraceptive services worldwide. That we should take that money and move it over to USAID and then reduce USAID's budget by a larger amount and reduce donations to UNICEF and other humanitarian UN agencies by hundreds of millions of dollars. I did a radio interview on Vermont Public Radio. You may have heard of Vermont. It's Bernie Sanders land. So I did an interview on Vermont Public Radio last week about what's the consequence of this and the global gag rule that effectively denies funding from the US government to NGOs that provide abortion information or services. And basically the answer is it will lead to a dramatic increase in unsafe abortions, a dramatic increase in the maternal death rate worldwide, and a dramatic increase in the infant death rate worldwide. Since regulations forced the Planned Parenthood clinics of Texas to close 2 years ago, we have seen a doubling of the maternal death rate in Texas, and this is now what we're going to impose on the rest of the world. Thank you.
Thank you, Beth. Piper. Let's see, to lighten it up, can we talk about cookies? Well, so thank you. It's so interesting to hear everybody's different perspective, and I come to this issue both personally as a woman, as a feminist, as someone who was told by her mother as soon as, by her breasts were budding, that control of her, that you don't ever want to get pregnant unless you want to, and this is how we're going to make sure that doesn't happen, and this is your key to equality. She had 4 kids, really early, and she was a great mom, but she recognized the economic and emotional pressure it was on her. So it was very personal for me. But then as I have grown up into a business person, healthcare is across the board. It's very interesting. It's kind of like all the things that government used to do, or we think government might be able to have a role in, now it's business's job to do all those things. If you want to have healthy employees who are contributing, are good employees, supporting your good employees is good business. You have to have people who are healthy, who are comfortable, who can control their own realities in order to be productive members of your team. And so healthcare, and particularly women's healthcare, so in the food service industry, we are I don't know actually what our population numbers is right now, but in management we have a lot more women than we do men. And there are also a lot of women who work in food production jobs, and a lot of women of different, women of color, women of different socioeconomic, and who come from different socioeconomic backgrounds. We pride ourselves on trying to keep a pretty diverse workplace, both ethnically and socioeconomically. But it's really come up as a huge issue that how much of our business we have to pay for, we have to contribute to the health of our employees, and how committed we are to it as an ownership group. And it is, just to give you a sense of it, so it's 5%, 5 cents of every dollar you spend at Grand Central Bakery, we spend on insuring our employees. And if you think about that, like people, when they think about your return on, everybody's like, oh, the line's out the door, you must be making so much money. I mean, we hope to make 8% is our profit. So we spend over half of what we hope for our profit on health insurance for people. So it is an issue, and it's an issue politically because the politicians aren't picking up the pieces and saying health insurance in general, and particularly health insurance for women and the way it affects women, they're not picking that up. And so if you want to be a conscientious employer, if you want to run a good business, if you want to be part of your community, you have to pick it up, and you have to start making decisions about people's lives. We have to sit in ownership meetings and decide what level of care our employees are going to get from this system. And I hate that. I hate having to make a financial decision about my employees' health, particularly the young women. So I've become you realize how these issues, the politics of these things that should be, control over your fertility is a basic right. Like, that is just the most basic thing in order to be an equal member of society. you just have to be able to have it. And it's shocking to me and makes me, we don't have any choice when you're in business. You can't just be like, oh, we're not going to take care of that problem. You can go and you can advocate for the government to do it, but you end up having to pick it up. And the same, actually, this is a little bit of a tangent, but I used to be a teacher, and the same thing happens in schools, where schools are supposed to fix everything, and now it's like businesses expect it. And I'm happy to do my part, and I love being part of the community, but I think that society has to start picking up some of the responsibility for taking care of society and not expect. Business can solve a lot of problems, and I'm really, really, really believe in the power of business for good. But I think that there's a bigger societal responsibility when it comes to healthcare, and particularly around women's healthcare.
Great, thank you. So in a moment, I'm going to ask you if you have questions for each other. But before I do that, there's been several people who have come in after the start. So I want to let you know that in this session, we are taking questions by the CWA app. So that you would find in your app store. And if you don't want to use the app, then our producers, which are in the back of the room raising their hands, they have post-it note cards. And they'll bring that to you if you raise your hand. And if you're a student, please note this in your questions, because we give preference to students. And questioners who would like to verbalize their question can note this in their text, including your name. And if I select your question, I will recognize you and invite you to the microphone. So this is your time to really think about what questions you have to make this a dynamic panel. And I will turn it over to the four of you and see if you have any questions for each other.
I want to know from Liz how we, some ideas about talking more about abortion, because it's certainly not considered polite conversation. And
right, and I think that's okay. I think that discomfort is what makes change. I think that when you look at models like ACT UP or the SDS, you have to talk about things, and maybe in my lifetime, I will be looked at as somebody who is an agitator, and people would, can't you just talk about all the other things that Planned Parenthood does? No, I'm not gonna, because I feel like when I hear, well, 3% of what Planned Parenthood does, it's only 3% of what they do. I'm like, I don't care if that's 100% of what a clinic does. It's a necessary medical thing that people need. And so for me, we talk about it in a myriad of ways. I think I often say, there's really incredible movements that are storytelling movements where people are talking about their abortions. There's people who are doing movements that are literally just cathartically shouting their abortions. And I think what those two things do are, if you're someone who's had an abortion and it's a very private thing for you and you can feel solidarity if you hear somebody else's story. I think it's very cathartic just to say it out loud, because it's a radical act to even announce that you've been there and you've done that. And I can't tell you, I got pregnant the first time I ever had sex when I was 16 years old. Catholic family, and I had to go through the experience by myself. I was in an abusive relationship with an abusive 16-year-old, and I found myself, before I even found a clinic, I found myself at something called a crisis pregnancy center. How many people here are not familiar with what a crisis pregnancy center is? So a crisis pregnancy center is a fake clinic that is often, many states will fund these clinics. The state of Indiana took they defunded Planned Parenthood completely, gave $4 million to create these completely unregulated clinics that will often literally steal the font and the look of a Planned Parenthood or of a local clinic. So if the abortion clinic in Indiana is called the Indiana Women's Center, they will open up a clinic called the Center for Women in Indiana. And they come up first on your Google search. And if you're scared, you will find this clinic, and you'll walk in, and there's some person wearing a lab coat, and you don't even think, well, they wear a lab coat at the lawn comb counter too at Macy's, but whatever, all right. They're 100% allowed legally to lie to you about that abortion can cause breast cancer, that you will have, you could have a mental breakdown if you had an abortion, infertility. They often give ultrasounds, and they will fudge how far along you are. Oftentimes they will make promises to a pregnant person who's really vulnerable and say, we'll get you a crib and diapers, just keep coming back for checkups. And they will give you these fake checkups until you are past the legal limit to terminate your pregnancy, and then they disappear out of this person's life. The average, it's about 50 to 1 of these clinics, of fake clinics versus an actual place you can get services in the country, and they're real. And it's like insanity. I had a woman literally say to me, after she showed me the book with all those creepy fetuses, she said, "Your options are mommy or murder," to a 16-year-old. So, yeah. So, it's this kind of thing that exists now in 2012, and I think talking about it matters because I don't think anybody should be defined by their unintended pregnancy. Like, who hasn't had unintended things happen in their lives? We all have. And it's part of what we go through. And there's a litany of, there's an arc of getting pregnant, not wanting to be pregnant anymore, to really being excited about your pregnancy and realizing that in your second or third trimester, you have a terrible thing develop in that stage, and needing that pregnancy. And what women have to go through in those situations is it's just horrible, and Dr. Hearn here in Boulder is a hero as far as I'm concerned.
Great. Thank you, Liz. Other questions for each other?
I guess I have a question for you about it's so wonderful to hear an independent person who has looked at the landscape of your community and made a decision to make sure that your employees are getting really incredible health care. When you look at a creepy conglomerate religious craft store called Hobby Lobby, who has not looked at or cared about their employees at all and has made like creepy decisions that wouldn't even affect their bottom line at all if they just allowed people to have the birth control and the health care that they need.
Yeah. Well, thank you. It's, being in business for good. Boulder is actually the home of B Corp certification. Does anybody know about B Corp? It's a really amazing, we are in the process of our B Corp certification. But being in business for good is sort of the only choice for us. I'm very lucky to be part of my mother started this business, my brother and 2 of our good friends are our partners. We've grown it slowly. We've been lucky to have some success, not have to take outside money from people. So a lot of people are like, what's your secret? I was like, we didn't have to ever get any venture capital. We started a bakery, it was profitable. We used that profit to start another bakery. We used that profit to start another bakery. Then the banks were like, oh, we can give money. We are slow. My mom started this bakery the first time in 1974. And then we kind of reimagined it in the late 90s, Jesus, I can't even remember, 25 years ago, whenever that was. Anyway, so it's been slow, and now we're about a $26 million company. So it's been slow, it's been steady. All the things that allow us to be good employers are because we haven't necessarily bought into fast, quick, furious. We haven't bought into a lot of the ideas about business. And none of us, we never, the bakery never buys anybody a new boat or a fancy car. And so I think a lot of it has to do with how people set up in business. So if you're an independent business person and you want to maintain your integrity, you have to be really careful about who you get your money from. And I mean, this may not be where you're after, but that's what.
No.
So that's what allows it, combined with values that you share as an ownership group, and using those values, communicating those values from owners through the employees to your customers, to the people you buy your ingredients from, to everybody who's part of your system has to be bought in at a certain level to the kind of values that you're trying to hold as an organization, about how you treat people, about how you pay people, about the quality of products you make. And when you do that, all of a sudden this magic thing happens. The money comes in. And I am a born-again freaking capitalist. If anybody who knew me in college was like, Piper runs a business? Well, they wouldn't understand it at all. Actually, doing the right thing works. It's amazing. So I don't know if that answers your question, but that's
Well, I want to bring in a question from a student. It says, a lot of times I have felt like being able to have sex without consequences of pregnancy make it more about the man. Now I should be able to have sex whenever he wants because now I have no consequences. Can you speak on that? Who would like to take that up? Bill and Karuna haven't spoken in a while. Would one of you want to? It's a big question.
I'm trying to figure out this question. The way it is worded makes me ask the question back, is this consensual? Because if it's not consensual on both parties, then it's not healthy. If it's consensual on both parties and enjoyable for both parties and planned, protected in a way that both parties agree to, then it's fine. But I'm not clear, the way the wording is makes it sound as if that may not be the case.
Great. Thank you, Karuna. You want to?
Yeah, so how many of you have read Peggy Orenstein's book, Girls and Sex? Okay,
Looks like we need to get some girls and sex.
you need to get a copy of Girls and Sex. I was on a panel yesterday about body image, and there was a brilliant woman, Anita, who does a lot of really great work on video games, who talked about the ways in which, in our culture right now, female power and sexuality are getting conflated. And the representations of women in video games is a powerful woman is sexually attractive, or, game, I don't know what we call these, not a woman, image, game image. There's a word for it, but, character.
Avatar?
Character.
I don't know.
Is sexually attractive for men, and it's through a male gaze, and et cetera, et cetera. And I think that I'm a parent of a 9-year-old and a 12-year-old. I am thinking about how we do sex ed for kids. I am struck, even on this panel, that we've assumed heteronormativity. We've assumed that this is not just that it's sex between men and women, but that it's a certain kind of sex between men and women that can lead to pregnancy. And we haven't talked about that yet. That's sort of the walking in with that assumption. And I think that, focus on intercourse as defining sex, we need to break that apart, for one thing. And I think also we've repeated what happens so often in our culture. When we teach kids, but in particular girls, about sex, the first thing we teach them is how to avoid pregnancy, how to avoid rape. We don't teach them about pleasure. We don't teach them about, how to feel good, how to make your partner feel good. And the result is that we have a culture right now where young women are having sex to signify their empowerment, and it may not be pleasurable, and we can talk about pornography and this and that, but it's bigger than that. It's how we approach sex at large as a focus on intercourse, as a risk avoidance for girls, and I think that's part of the issue. And so I would really like to encourage us to what I keep saying is, I believe that when we talk about sex, and I think we need to think about sex in its broadest ways of physical pleasure shared between two or more humans. I think you've got pleasure, and that's worthwhile, and that's valuable, the sexual pleasure. You've got relationships, partnership, intimacy, that's also worthwhile. Maybe they go together, maybe they don't. That's also okay. And you have reproduction. And you can reproduce in lots of ways. Not everybody in this room reproduced because their parents are here because their parents had sex. There's lots of ways to make babies, and sex is but one of those. And I think we need to separate these three things and acknowledge sometimes they come together and sometimes they don't. But if we really give all of us, especially women, permission to have and seek and enjoy sexual pleasure, to me, this is kind of what's been missing in our culture. Destigmatizing abortion, but also asserting female pleasure.
I think that's right. I think for me, just in reference to this panel, legislatively, if there are enormous consequences to you asserting your sexual pleasure, legislatively,
Yes.
You aren't even going to be thinking that it's a smart thing to do. Forget about it's your entitlement as your own body, and I think that's really scary. And I also just want to say, too, Ivanka Trump's I'm really supporting women plan for like family leave, only the only way you can get those 6 weeks is if you have a child through basically you bear the child, and that like they don't give you any time off if for like fertility or anything like that. It's like crazy. So like even that's like a thing where people look at that, and also they take money from low-income programs like TANF and stuff to pay for time off for that. So I mean that's just also another piece of great Trump awesomeness. But yeah, I think, but that question was, I found it very interesting too. And I just think if you're looking at your own sexuality through the lens of how it empowers if you have a male partner and that partner, I think that maybe talk to somebody about that, because I think that that might be a helpful thing to kind of do a little reset on what's happening.
Great, thank you. I want to take another question from the audience, which I think is related to this. This audience member has 3 preteen and early teenage boys, but I want to also expand it to girls, just from how we're talking right now. And as a parent, what are the most important things we should be talking about regarding sex, and how has our education for kids changed, and maybe what do you feel like is really needed as we talk to kids about this?
As a parent, and I do have girls, I think we all need to be talking about consent all the time. I think we all need to be talking about, it's sex and other things. It's also deboarding airplanes.
Yes,
It's a lot of kinds of consent.
We're united in that.
Consent starts early. It starts with, what do you tell your kids to wear? It's kind of body integrity. It's a sense of body integrity, and it starts early. And all of us need to help kids enjoy and experience and feel entitled to that. We also need to teach kids early about other people's feelings, and what feels good to you, how does that feel to someone else? Feelings are more than physical, they're physical and emotional. And I think, I feel like when I say this, it's a little bit oversimplistic, but I really see this as like a lifelong process of how you relate to people, how you think about violence, how you think about your entitlement. And so it's just so much bigger than sex ed. It's how we approach relationships, entitlement, violence, and sex is but a piece of that.
Yeah, I don't have any children, but I like to be an expert on lots of things. But I was having a conversation with a close personal friend who has 2 teenage boys, and they're having this. I was like, so how are you talking about? I'm from Portland, Oregon, so the hot topics for teenagers are pot and sex. How do you talk about pot and sex? And so she was telling, and she's like, well, blah 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 blah, and then the conversation kind of drifted into the status of her marriage, and she let me know that they aren't having a very active or healthy sex life, that they're really busy with the kids, whatever. And I was like, yeah, make sure your boys are responsible and respectful, but also model them a healthy, happy sexual relationship, please. Get to work on that.
Yeah.
Well, I think that it's recognizing that our daughters are sexual beings is something that doesn't happen a lot. People like to, how many times you go, I don't even want to think about her going to school and having sex. Think about it. Because it's really important.
Want your daughters to have good and pleasurable
exactly.
sexual
And also
experiences.
and also just it feels to me like every time we talk about sex and then it goes into like what happens with sexual violence, it's always the girls and young women's responsibility to not get raped. Take these classes, don't drink, don't wear that. Talk to your boys about what that means. And also, it's like, I don't know who started the narrative that if you have to be consensual, that it's make sex less fun. I mean, starting with, can you get off my hair, to I don't like it there, to stop that. Like, those are real things. When you're conversing during a sexual encounter and relationship, understanding that stopping at any point is real, but also that when you say no, it doesn't mean, sometimes it means we're going to stop having sex now, but sometimes it simply means we're going to have sex in another way. And so explaining what all of those different navigational tools are and doing it in a way that disempowers, men don't feel like they're always the aggressor and the initiator, and they're not entitled to that. And women feel like they can ask for what they need. And I think those are really important things to talk about with our kids. I don't have any either. I have abortions. See, you laughed about abortion. That's what we're doing today. Feel good about it.
Bill, I'm wondering how the shows that you're doing on radio and TV kind of play into what we're talking about of forming young people's perspective around their sexuality.
Very much so. And on a lot of issues, including some of the things Liz just talked about. So, for example, there is a program created at the University of Denver by Howard Markman called Prevention and Relationship Enhancement Program, PrEP. PrEP is a couples counseling program for couples engaged in domestic violence. And basically, my understanding of it is the way it works is if you can get the battering man to come for a week of counseling, they go through learning empathetic communications to understand the other person's point of view and to repeat it to make sure you've got it before you state your own, so that you're actually having a dialogue about the issue you're disagreeing on and not getting into dehumanization and violence. And since violence is one of the biggest public health issues on the planet, affecting an estimated 1/3 of women worldwide, including physical violence, sexual violence, and abusive psychological violence, it's a key public health issue for us to address when we're dealing with human relationships. So one of the counselors who was trained by Howard Markman came to me after she learned about our work from Stanford psychologist Albert Bandura, and she said, you know, most people don't have access to a trained counselor, and most people have no clue how to carry out empathetic communications. So why don't we create a manual for entertainment media producers on how to model this in their programs? And so she and I got funding from UNICEF and the American Psychological Foundation, created a manual, and then she did 2 training workshops for our writers in Ethiopia who found this revolutionary, even in their own relationships. And we're now in the dialogues where characters are in conflict, parent-child, spouses, teacher, student, employer, employee. We are modeling empathetic communications for that entire nation through the characters in the program. That's just one example of how we address these kinds of interpersonal issues. It's very clear, as Liz was commenting, this interpersonal relationships is what a lot of our life is about, and it's not a simple, no, here's how sex works. It's a complex interplay of people engaged in relationships. So modeling healthful relationships is a way to gradually bring about change, and modeling people who are within that cultural context is critically important, so people will relate to the characters. You can't parachute Gloria Steinem into Sudan as a role model for how women there should live. Better to find some, the one person who's not beating his wife and hold that person up as the role model. So at any rate, that's one part of what could be a whole day-long discussion of how we model human relationships in these long-running programs.
I mean, and I would just also say too that we need to be a vocal opposition to those who create the fairy tale notion that we live in a world with abstinence and unicorns, because there's never been abstinence. We don't live in this world. It's like, did you ever study the age of abstinence? No, because it never was. And so since we are on, I mean, it's like so ridiculous that we just so often allow this conversation then to become a narrative truth, and then our politicians buy it. If we are not a vocal opposition on these issues, if we are not a present voice, and I just want to bring it back to abortion and reproduction, because I've been to 95 clinics in the country, and I visit the clinics. And when they say to me, first of all, sometimes they say, "Why did you come here?" Because no one comes there to visit them. They've been so shamed and so stigmatized, and they're providing a service in a community, and many people don't even know that they exist. 70% of all abortions that happen in the country happen at independent providers. Planned Parenthood is an incredible provider. I love Planned Parenthood. They're amazing. But they're part of an incredible community of reproductive health that we need to learn about so that we can be their supporters. And so that's why I started, when you brought up Lady Parts Justice League, we're going to 16 cities this summer doing comedy shows that gather people like this, and then we're going to have a talk back with providers so the provider can tell the audience what they need as support from their community, so people can sign up to be escorts, maybe start an abortion fund, or just connect with the clinic so that they can 4 times a year bring cupcakes, take their staff out for drinks, remind their staff that what they do is incredibly important and that you honor that, because we're at a crisis point where physicians go to work every day through an onslaught of people who are telling them they're awful, and the burnout rate's really high. They don't like to talk about it even amongst themselves because they feel like so shamed. So to be able to be a part of a community that, while you're beating back on legislation and being awesome, realizing that every single day people need to go get these services. And for you to say, we're happy that you're in our community, we'll stand with you and support you when you need it. We will provide our emails, so if you have a surprise attack onslaught from protesters, we can come and show up. It's just critically important. And using pop culture and storytelling and narrative is such an important way, and I'm so thrilled by your work and what you do. And I think that it's really, really important. People don't talk about it enough. And even we veered away a little bit with important topics on sexuality, on domestic violence, all that. But like when it comes to reproductive rights and access and abortion, we need to talk about what we're going to do and how we're going to be advocates and what that means.
Great. Thank you. So I have a question from Andy, who's a student. And Andy, if you want to ask the question yourself, you can go sit in this chair and I'll call on you after this next question. I'm going to ask another question is, how worried do you think we should be that Roe versus Wade will be overturned by the Supreme Court?
Thanks, Colorado.
I
For the new
guess-
justice. That's all I'm saying.
I guess I would say what we should be very worried. I think that our worry should have started in 2010 when we watched state legislatures impose these horrible trap. Well, actually, we should have been worried in 1992 when a Supreme Court decision after Roe that was called Casey versus Planned Parenthood decided that you could impose restrictions on abortion in a state-by-state basis if it didn't pose a, quote, undue burden on the patient. Now, they didn't define what an undue burden was, which means that all of these regulations started happening wildly, really, in 2011. And so we have governors who are hostile to abortion. We have 26 state legislatures. If we have 2 more, they could literally make constitutional amendments to literally ban abortion, do whatever they wanted. That it's crucial to understand what is happening in your state, because if you do not have state legislators who understand science, if you do not have a governor that understands science, what's going to happen is they're going to pass crackpot laws, and you've seen them because you live in Colorado. I know your peeps. You've had 3-time personhood bills. What the fuck? But if you don't have that, you don't know those cases will pass. and travel. They'll get stays, but they'll travel through courts. You don't know if a court will take that up. And then we have a Supreme Court that might change the rules. The 20-week abortion ban is something that is really terrifying, that could probably make it to the Supreme Court and possibly pass. And that will be the first step into undermining Roe in a profound way.
Anyone
Yeah,
else want to
it
say
feels to
something?
me like it's going to be this slow erosion, and the most vulnerable are the first affected. And so I, as a middle-class white lady, will always have access to, well, not, I don't know always, but I would go to Canada, whatever, we figure it out. But the people the people most vulnerable and who potentially cost society the most are the first who are lined up to be denied access. And that is the most inverted, weird ethics I can possibly imagine. And it's not good government, it's not good business, it's not good for anybody.
Well, Oregon's the only state in America that has not put restrictions on abortion access since Roe v. Wade.
Yeah.
It's the only state. And so it's crucial to be, if you're a citizen of the world and you actually care about human rights, like, this is an issue that if it's happening to someone, it's happening to you. I mean, that's just the bottom line.
As proud as I am of Oregon's progressive history, we have not, the government hasn't restricted it, but access is still an issue. On the east side of the state, the only place you can get an abortion is in Bend, and that clinic is under constant pressure. And along the I-5, it's basically just Portland, Eugene. I'm not sure about Ashland right now. I think it's not. So yes, it's still available, but if you're a working class woman from the east side of the state, it could be a 7-hour drive, have a procedure, drive back, miss 5 days of work. It's still not, I wouldn't call it good access.
You can get medication abortion from your physician, though, from your doctor.
Yes, that's right. And there are private. The other thing that no one ever talks about, and I love this, is private physicians who quietly perform abortions in their offices. And I have a friend who's a family practice clinic in a small town in Eastern Oregon. She'll do it, she calls it a DNC. She'll do it, and again, she's shamed, and she can't be. Everybody knows that she'll do this. She can't publicly, make a big noise about it. But I think that there are probably more examples of that out in society than anybody knows about.
Yeah, and some of the legislation that's coming down the pike in states, just so you can get a gauge of like where Roe is versus how we're eroding it without actually overturning it, is many states have a law that it has to be a physician that performs an abortion, which is absolutely unnecessary. LPNs can do it, trained medical professionals can do it, and especially with a medication abortion now, there is no reason that a physician has to dispense abortion pills to a person. I mean, that's just ludicrous. Some other states are trying to pass laws where you have to be an OBGYN to perform an abortion. They will, in some states, it's like, even though the Supreme Court last June got rid of some of the trap laws that they said were burdensome, it takes a really long time to get some of it doesn't just overturn the rules, the state has to go through it again. So admitting privileges for a doctor, like when you hear a lot of these things on their face, they sound great. You have to have admitting privileges. Here's the deal. To get admitting privileges at a hospital, you have to prove a couple of things. One, you have to prove that you're going to be bringing in revenue to that hospital, but abortion is so safe that they can't get admitting privileges because they're not going to be bringing revenue because nobody has to go. And also, you would just go to an emergency room if there was a problem anyway. So they won't give them it. So it's like, it's that chicken and egg thing, right? The waiting periods are the thing that I'll stop my yammering, but this is like, I love talking about abortion. I could do it all day. Is when we impose waiting periods, again, it seems like, oh, shouldn't a woman wait to really make a profound decision like that? Anybody who's ever experienced pregnancy, it's either, oh, yay, or oh, shit. And so the second you pee on that stick, you are thinking about it from a number of angles. Can you afford it? Do you want it? Is it part of your life? So to impose a 24-hour, 48-hour, 72-hour waiting ban that puts a woman's clarity of what she wants into question doesn't stop at whether or not she wants to terminate a pregnancy. That becomes a societal question that all of a sudden we start asking of women. Are they capable at all? Are they capable of running our country? And I think that that kind of thing we really need to take stock in, because not only are these laws undermining our autonomy, they're undermining how society views women and the capability of who we are.
Thank you. Andy, you want to go to that microphone across the room? So Andy is a student.
Sorry, I'm short. So I am a student here at CU, like she just said, and I'm also the incoming president of the Gay Straight Alliance here. So modern feminism, even extending to reproductive rights, can often be interpreted as a white, cisgender, straight women's issue. And Liz mentioned the lack of women of color on the panel. And I've also noticed, at least from what I can tell, a disparity in the representation of LGBTQ individuals. So that being said, I'm interested in hearing your perspectives on the rights of individuals who do hold that intersectional identity.
I'll jump in here with that. So I feel like everything you said is correct. And I think that when we talk about, I was talking about abortion access, but if we're, a really important panel to have would be a reproductive justice panel. Yeah. Because reproductive justice takes us out of the lens of this and talks about one of the things that I discovered when I really went on this journey for me in what is the full panoply of reproductive health care for all of the communities you just talked about. When trans folks need reproductive health care, even at places that were great, people are getting better, but it's still really being respectful of pronouns, understanding the reproductive health needs of a trans man on a trans man's journey. When testosterone hormones start happening and hormone replacement starts happening, your risks of endometrial cancer go way up. Do clinics that are affordable for people who are on, like, not only not in just the binary that we're talking about now. Do health providers know that? A lot of times the answer is no. You know, when trans women need sexual health, are people saying, how are we creating incredible programs for anal cancer screening, prostate screening? You know, what does that look like in the landscape of who we are as people talking about reproductive care? Even further, what about when we talk about people of color who are of low-income means, who want to have a kid, who want to have a kid, and what are we providing for them when it goes to that? It's like, are we providing really good comprehensive health care and then in turn helping them raise healthy families? No, we're cutting off access to any choices they may have and then cutting off access to any choices they would have about trying to raise a kid, whether it's TANF, moving money so that rich ladies can have a whole lot of fucking maternal time off and not giving that kind of help to poor people. So I think that that's why when I said at the top, I wish this panel would have that diversity just so we could hear that kind of thing and we could talk about a larger gender spectrum of it. I don't feel like I'm the person to talk about that because I'm a cis white lady who just gives a shit that if somebody's pregnant and doesn't want to be, that I can help them do that and that I can make them feel like there's no good abortion or bad abortion. There's only the abortion you need. So that's kind of like my larger journey, but I'm glad you brought up that question because I think it's super important and I hope I helped.
Thank you.
Great. Thank you, Andy. So this might be our final question, and what I'd like to do is just give each of the panelists an opportunity to answer the question and give any final thoughts that you have on the topic. So keep yourself to, right around 2 minutes. And Piper, maybe we could start with you. It's a student's question. It's, as a young woman, I consider myself a feminist. What are ways I can be more involved and more supportive of women's rights on a larger scale? I think it's a good ending kind of thought.
Buy Carol Gilligan's book In Another Voice, share it with 3 of your girlfriends and 4 of your boyfriends, and talk about it. That's it.
Whoa.
Educate. I just think it's about, and I think we don't have to reinvent feminism. It's been here. It comes in and out. That's the problem. And a lot of the early feminist stuff is really powerful, and I kind of like to return to it.
Okay.
Oh, it's Carol Gilligan in another voice. It's early. She's a social scientist.
I think my comment in response to the question and in response to a lot of the focus of this panel is we naturally focus on where we live. So we've focused a lot on the United States. And indeed, thanks to people like Gloria Steinem and others, we have made huge progress. We're clearly fighting a downdraft at the moment, but we've made huge progress in the rights of women and girls in this country. But look beyond this country. In Kyrgyzstan, 1/3 of marriages are through abduction and rape. In Ethiopia, this is considered a rural cultural tradition. There is so much to be done for the rights of women and girls. People always say, well, what we need is girls' education. Of course. In Ethiopia, we got a letter from a woman in Oromia saying, thank you for dealing with the issue of marriage by abduction. Our own daughter was abducted on her way to school at age 14 and ended up married as a result. And we've been afraid to send the 12-year-old girls to school for fear that the same thing would happen to them. When your program addressed this issue through the character Wu Balam, our entire village, which was listening to the program, came together and we agreed to enforce the law against marriage by abduction, which we had not known existed. And now it's safe for our 12-year-old girls to go to school. Please keep your program on the air. So there's so much we can do for the rights of women around the world through understanding the UN agreements regarding the rights of women and girls and the policies of various countries, some of which are badly lacking, particularly with regard to child marriage, and get involved. It doesn't have to be in Boulder, it doesn't have to be in Colorado, it can be anywhere. There is so much to be done.
Yes. I guess what I would say is, I'm gonna take a little bit of issue here with you, Piper, and that is,
Good.
we need to reinvent our feminism because it's been from a white lens for a long time. I think that women of color have been driving this movement for a long time, and it's super hard if you were to just literally, if I were to say, name 3 black feminists right now who are making a difference. I would never put anybody on the spot, but think about that for yourself and what that means. Your feminism should be intersectional. You need to look at what kind of feminism you're living now, and are you giving voice and centering people, and are you building a table? Because a lot of people say, we need to have a lot of people at the table. You know what? Smash the table and get a new table that you're building with a lot of people who don't look like you, and think about how those things intersect. And sometimes take a step back, look at the work that women of color are doing, and be a pack mule in that fight. And what I mean by that is everybody knows if you work in nonprofit and you work in things that are really hard, people have really incredible creative things that they are doing and really great projects that they are doing. And the overload of having to do the paperwork, set up the chairs, do the bullshit work, when you see an incredible visionary who's somebody who doesn't look like you, offer to do the bullshit so their vision can be focused on by them, and you can be an incredibly helpful ally, and then you're creating this incredible weave, prioritizing all the different things, including the international piece, including the piece of people who want to have kids, including the piece of what justice looks like. You know, part of reproductive justice is, can you have a kid that is not going to be shot by a cop on the street? You know, that is part of what we're talking about, and all of those things intersect and matter, so make your feminism intersectional.
I mean, I call that a mic drop, so it's hard to follow this one. You know, so here we are talking broadly about legislation and reproductive justice, reproductive rights, and I absolutely second what you're saying. You know, interpreting reproductive justice in its most broad understanding of if you have children, when you have children, how you have children, the right to raise those children in a safe environment, and we need, with dignity. We need. It's a full package, and kind of in beginning by talking about the ways in which politicians are trying to signify that they care about women's health with basically empty legislation. Let's go back to in my view, the underlying thing that we all need for good health, for that piece of reproductive justice, and that's universal health care. And so I will end by saying I think we need to be working for universal, evidence-based, affordable, culturally competent health care that addresses reproductive rights, and we need to be building an intersectional feminist movement that addresses the full scope of reproductive justice.
We have 3 minutes, so we can't go long on this. And I'm having a little technology crisis. So student, I can't remember exactly how you worded your question, but it is a student that says, we really don't talk about how to get out of abusive relationships and tips on how to do that as a young woman. So if we can just be really brief, because we just have a moment, but anyone feel really drawn to be able to answer that?
I think that's a really hard question, not knowing someone's circumstance, but I know I was somebody who was in an abusive relationship for 3 years. And I think that it's a really hard thing to get out of, because what happens a lot is that person isolates you, and then that person defines you, and then sets a standard that makes you believe nobody loves you, and that you deserve the abuse. And so what I would say now is I wish I it's just, I don't know. I wish I had a better answer. I got out because I went away to college, and being away from that person opened my eyes profoundly to that it was bullshit. Wow, people liked me. People found me interesting. Everything that person said about me wasn't true, and that empowered me. But I know that there's a longer, greater place to do that. And you know what? Here's what I will say. If that person wants to talk to me afterwards, I know that there's somebody in this room who might be able to have some answers for me and for that person, and maybe we can talk to that person. Maybe, is that right, person who I see in the room here? Yes? Okay, good. So meet me in the corner if you want to talk about that. Or just maybe I'll put it on Twitter. I'll find out some really good resources, and I'll put it out on Twitter, and then you can look at those resources.
Great, thank you. Bill?
Just a quick comment. Season 2 of East Los High delves into this issue in depth, and I encourage you to watch it, because the lesson basically that season is trying to teach is get out of the relationship. Don't expect that he's going to change.
Yeah.
Great.
Yeah.
Yeah.
Thank you very much.
That thing about the program, my basis is
I want to thank all of our panelists for giving their time. Let's give a big round of applause.
You guys were all great. Yes, you. Also, I'm just going to put a plug in. Go to ladypartsjusticeleague.com. It gives you a lot of places that you can help support clinics locally, and clinics who are in states that are really, really oppressed. It's really easy things to do that make people's lives better. Bye.
Please remember to give to CWA and exit through. Which doors do we want them to exit through?